jobs just in the last few weeks, trying to figure out how to get through the end of the month and pay the rent and put food on the table. We're looking at the fact that, as with any crisis, it highlights disparities, and in this case, disparities based on race. I think of it in terms of disparities that have long existed and are now highlighted because they are exacerbated in terms of health disparities, economic disparities, educational disparities. COVID-19, 40% of the deaths in the United States for COVID-19, 40% have been Black girls, despite the fact that we're only approximately 13% of the population. You look at what's happening in terms of documenting long-standing health disparities around everything from asthma, 20% more likely to have it, high blood pressure, 40% more likely to have it, lupus, Black women 3 times more likely than white women to have it. And this disease, this coronavirus, attacks people who otherwise have health conditions. So we've got a lot at stake. You look at it in terms of the fact that Black folks are far less likely to be able, based on the nature of their work, to telework. So that means they're either getting out there and trying to go to work every day, often without paid sick leave, or staying at home, which means that they actually don't have an income. So there's a lot to address, a lot to talk about, a lot to fight for, and it is worth it. It is worth it. We're going to get through this because we're all in this together. And again, thank you to all the leaders for being a part of tonight.
Good evening, everyone. I hope everyone's blessed with their families. I'm a little nervous. I never did this before. But this is a very, very, very crucial time. This is one of the reasons, the primary reason why I started Revolt, so that we would have a platform. As we look at the news channels and the other media outlets, we don't get a chance to talk about the things that are important to us as a people, as a nation, ever, about anything. And so with Revolt, we wanted to one day have this dream come true where we could all get together and not be edited, uncensored, and tell the truth about how we feel. Talk about the facts about what affects our well-being, to have a voice. I've been inspired over the last couple of years by one of my brothers who's been on the front lines on giving us a voice. His name is Van Jones, and he's going to help me tonight as we discuss state of emergency, life or death, the way African Americans are dealing with the coronavirus. Excuse me for being nervous. I'm gonna pass it on to Van, but this is not what I do, Van. So you take it away. I just wanted to bring everybody together.
Now, listen, I think we all have emotion because we have a pandemic jumping on top of multiple epidemics already in our community. And somebody needed to step up and sound the alarm. And I just want to give thanks and praise to you, brother, to have the platform that you have and to have the heart that you have. It's unbelievable that you're going to be able to, I think, maybe save a bunch of lives tonight, because the truth really hasn't been told yet about how dangerous this virus is for Black people in particular. We've talked about old folks, which is true, but you can be 30 years old and die of this if you have high blood pressure. Your 27-year-old nephew who's got an inhaler can die because of this virus. We have to look at the Black experience of this. And that's why I'm so glad that we're here. And there's been nobody who's been more clear about the dangers to the Black community and more effective at mobilizing people than the next voice you're going to hear. Angela Rye is a legend already at such a young age. She is the link between Black politics and Black culture. She brings the generations together. She coined the hashtag #ThatRona, and she's been unstoppable in educating our community. I want to bring to you the voice of Angela Rye. Angela Rye, I am powerfully moved by you every time I hear from you. You must be breaking, your heart must be breaking seeing these numbers coming out. What does the Black community need to know about this horrific virus that's not been told enough yet? I can't hear your voice yet, sister.
taking
got to
the
take it off
microphone
mute,
off, and it
Angela.
would probably help, wouldn't it?
No.
So, you know, people are already out here trying to silence me. It's a conspiracy. I don't know what's going on. I have to unmute my own mic. I was saying, Van, thank you so much for the very warm, probably overly generous introduction. And I also want to, of course, thank Puff, who I truly think is my real sibling, for always having the vision, for always pushing us to do the most, especially in times that are so desperate, such as these. I know that you're going to get to Rev, but because he's a mentor, I have to recognize Rev. I would not be on TV today if it were not for Reverend Sharpton. And my sister, AOC, she's just always so inspiring. And everybody else, Mayor Cantrell, the sister who is a brilliant scholar that will come in and just school us. I've learned so much from her Twitter. But I do just want to say, to me right now, this coronavirus really gives us a unique opportunity. It gives us unique opportunity to come together and solve for things just like our communities always have from the beginning of time here in this country. I think it gives us a really unique opportunity to teach the masses what we mean when we talk about disparate outcomes in healthcare, when we talk about the ways in which we are oppressed economically, when we talk about racism, structural racism, and systemic oppression. Coronavirus gives you exhibit A through Z. And I think that this gives us the opportunity, if we are honest and if we are willing and if we are open, and by we, I'm talking about you allies, from the federal government on down, to listen to us finally when we say, when America catches a cold, we catch corona. That is exactly what happens. We are ill prepared in our hospitals, in our schools, in our doctor's offices, in our grocery stores. We are ill prepared at every turn. And the only way for us to truly survive this won't be through a federal stimulus bill. It will be through a community stimulus plan. And so we have to start to lean on each other to ensure that we're doing our very best, just like we've always done. I know y'all are tired, but this is the time for us to really rally together and make sure that we're all good.
Well, listen, I think that's powerful. I haven't heard that before, but a community plan as opposed to a federal plan, and that's the only way it's going to work anyway. Somebody who understands.
Already.
Yeah, but I tell you, one person who knows how to connect community and the federal government is the next person we're going to hear from. The also legendary so-called AOC. I like to call her Congresswoman Alexandria Ocasio-Cortez. How are you feeling about the situation that we're in, and what can we do?
Thank you so much, Van, and thank you, Diddy, also, because, you know, something that you said in the very beginning of this is that you're branching out and doing something that you've never done before. And that's really what this moment calls upon all of us to do. We all have to do more than we have ever done before. And all of us have the power to do that. And whether you're a celebrity or whether you're an everyday person, we all have the power to convene, and we all have the power to convene our family, our community, or even around policy. And that's really what we need to do right now. Just over the weekend, I started sounding the alarm because my district, New York 14, is the most heavily impacted district in the country. Out of the top 10 zip codes in the United States most heavily hit by corona, 5 of them are in my congressional district, and including the number one neighborhood, which is Corona, Queens. And we started seeing this, and I was out in the streets, I was out with people, and I was seeing firsthand that this is disproportionately having an enormous impact on the Black community and Black and Brown communities overall. Rikers Island is also in my district, and this is where we're starting to see the intersections of what this crisis really means. Because when I first started sounding the alarm on this, people said, a virus can't be racist. Well, no, biologically, a virus can't be racist, but our policies can be racist. There's a history of racist policies. And just like we saw with Katrina, just like we saw with Hurricane Maria, when a natural disaster comes in, or when a virus or a pandemic comes into a community that's already been weakened and ravaged by policies like mass incarceration, redlining, the war on drugs, police violence, etc., this really creates an added issue. In addition to that, we have issues like environmental racism, where Black and Brown communities are treated as a dumping yard, as a place for people to pollute. The South Bronx already has one of the highest asthma rates in the country because we decide that those are communities where it's okay for trucks to put smog, for factories to put out waste. We saw this in Flint. We see it in Baltimore. We see it in lead levels in our water. And these all contribute to pre-existing conditions. Structural racism is a pre-existing condition. And so from that, now we're seeing that the highest mortality rates in this, the highest concentrations are in Queens, in historically Black neighborhoods like East Elmhurst, like Corona, where Louis Armstrong wrote It's a Wonderful World about Corona, Queens. And we're seeing the highest mortality rates in the South Bronx. So it's no coincidence, but it's up to us to connect the dots, because when we try to pursue race blind policy, what we're doing is that we're pursuing and advancing policy that denies the impact of racism in this country, which means it does not solve our problems.
Congresswoman, there's one thing I need you to kind of break it down for us in a little bit more layman's terms. Like, people are dying out there right now. And when they hear policy, that's when we kind of lose the generation that we really need to take a lead on this. So what could you say to them to kind of break it down in a way that they'll understand it, of what to do right now? And do you agree, because I call this life or death, and we sounded an alarm, do you feel like this is a life or death situation?
Oh, it is 100% a life or death situation. And, Angela brought up something really important where she talked about a community plan, which is that we don't have to wait for elected officials. We don't have to wait for the federal government. We need to apply pressure and make sure that they are responsive, but we can act right now. You just go out into your building, knock on every door on your floor, and you can ask people through the door. They don't have to open it. But you find which apartments in your building have elders, and maybe you can go to the grocery store for them. Try to pick up a prescription medicine. Let them find out what people need, develop a plan, and actively build community so that we can look out for each other. Because at the end of the day, we are all we've got. We are all that we've got. And we have to translate that power in community, in mutual aid, yes, in political organizing and voting, but all that is the bare minimum. What we really need to do is come together and actually actively support each other with our actions.
I tell you, that is powerful, and Reverend Sharpton has been doing that for years. He's the template that all of us have been following for at least my generation. Like, you're our guy. You've been there through all of it. You've seen everything we've gone through. Tell us how you see this situation where this virus has jumped on our community, and because, as was just said, we already have an epidemic of hypertension and these other issues that make the virus more lethal. We now have Katrina everywhere. We have Hurricane Maria and Sandy in every community in our nation. How do you see it, Reverend Sharpton, and what should we be doing?
Well, let me first thank Diddy for convening us. And since I've known him since he was a teenager, he's always stood in the gap and never really got the credit he should have as the cultural icon that he is. I'm not surprised he did it, but it couldn't have been a more timely way of bringing us together. And I really love him for doing this, and you, Van, and what you've done in your leadership and advocacy, and my little sister Angela Rye, and AOC, who is a member of the family of all of us in terms of putting the spotlight. Let's first understand that the coronavirus pandemic did not start the health in disparities. It put a light on the health disparities. It's like whatever room you're in that was in the dark, and somebody comes and cuts the light switch on, the coronavirus pandemic put the light on what was already there. We in the Black community were always number one in all of the health disparities that made us the candidates for getting the coronavirus. We were number one in heart ailments, we were number one in asthma, we were number one in hypertension, number one in obesity. All of that because we get the worst health care in terms of how services are rendered, in terms of how we are impacted in our environment, and in terms of institutional neglect. So it didn't start with the coronavirus pandemic, it really illuminated it. And the ugly part about this, Diddy and Van, is that they started by saying Black folks are not going to get coronavirus. Now we're seeing we double and triple to everybody else. So you still have so many of us running around talking about we're not going to get it, and we're the ones that are getting it even more. And the cities that we populate are like Mayor Cantrell, who's done an awesome job down in New Orleans trying to deal with this. They're trying to deal with a community that had been put asleep. People like Charles Blow, who wrote a piece, everybody ought to circulate his New York Times piece. I don't know if he's on yet, but giving the actual data of where in Milwaukee, Chicago, and other places, we are double to triple everyone else. What we are not dealing with is that we have the least amount of health care facilities in our community. So when you talk about high density, it is an insult to tell people that are in housing projects like I grew up in to have a social distancing. How do you have a social distancing when you're in an elevator that's basically 4x5 and trying to get upstairs if the elevator works? How do you deal with those kinds of realities in the environments that we're in?
Reverend.
So I agree with the Congresswoman. The first thing we do is need to reach out to each other because we need to have our own plans that work for our communities. That's one. Secondly, I think we need to deal with the fact that there are basic things that are needed in our community that we do not have. At National Action Network, we've been passing out prepackaged food with our alliance with the World Central Kitchen. Every day we've been doing 2,500 meals a day in our Harlem branch, another 2,000 in Newark, another in
Reverend, that,
New Jersey.
I've seen those images of you out there with the mask and all that stuff, showing that level of courage. You know, Angela, you were the one who mentioned the term community from the very, very beginning.
Van, can I need to interrupt you for a second. It's very important. It's very important. Everybody that is on this with us now. This is not MSNBC. This is not CNN. It's not Fox News. We have to get to it. We have to get to what's really going on. We have to be selfish, finally, for our communities, and we have to get to the truth. If we're going to sit up here and we're going to sound like we on any of those other non-Black owned media networks, and we're not going to get to it like if we were sitting at the table, it's a waste of time because everybody's tuned in right now, and we need to get to it. And I just want to make sure that we get that energy, and we don't get, we understand we at a new place and things are severe. And if I rang the alarm and said that it's life or death, that's what we got to talk about, because and we need to talk about the issues that are really there. And Pops, I want to get back to you. I call Al Pops, if y'all don't know. That's my Pops right there. But I want to bring in Charles Blow real quick, because I know Charles is with the smoke. Charles, give us some smoke to wake the community up. And then Pops, we going to go back to you.
Charles, you're on mute.
Charles, you're on mute.
Oh, I'm on mute. How did that
There you go.
No,
you're here.
Now you are.
I'm good? Okay, good. Reverend Al brought up a lot of really important points. One is we have to break through a lot of conspiracy theories. Number one, you can't get it. You would be surprised how that is sticking, and people still believe that this has nothing to do with me, that this is this is a jet setting disease. This is a cruise ship disease. This is a spring break disease. This is
I'm
an
gonna be
Asian
honest,
disease.
Charles.
Right.
I was one of the people. I actually believed that. I was like, God has to give us a pass. We have, this has to be the one we're gonna get a pass. So I actually am one that can say I was guilty for that, and that's one of the reasons why we have to get this message out. Sorry to interrupt you.
No, that's fine. But the thing that people have to always remember, this is one pandemic. There will be other viruses. There'll be other calamities. They will always settle at the end of the day, no matter how they start, no matter how rich the people were who first affected, no matter if they're medical, whether they're on planes. It will always settle at the end of the day on the most vulnerable population. You will never escape it. And once it stops affecting the wealthy, the most famous, the attention averts. We still have an epidemic right now. I now live in Atlanta. There's an epidemic right now in HIV. We have treatments for it that keeps you from passing it. We have treatments for it that keep you from getting it, and yet it is surging. But because it's not Rock Hudson anymore, it's not rich white artist in Soho anymore, nobody seems to care. And so this is what we're going to be facing, which is once it is no longer a daily press conference by Donald Trump. It is no longer a daily press by Cuomo. Once it moves out of New York, out of San Francisco, out of Washington State, and it starts to settle in Alabama, in Mississippi, in I don't know who that is, in wherever, it's just going to be you. And it's just going to be us. And we are going to be stuck to deal with it. And the world will have moved on, and Trump will have opened back up the government in some, big bang way. And we will be stuck with this. And so we have to figure out, what do we do with this knowledge? I had someone today message me to say, stop making this a Black thing, because if you do that, they're going to stop caring. First of all, I can't make anything. I'm following data. But number two, think about how damning it is to say that if it's just about you, no one will care. And that part of the statement wasn't actually wrong.
Well, now you started to bring some real smoke. But I want Angela and I want AOC to jump in here. Now we got some smoke going. Angela, you got some smoke?
Yeah, and I think that we have some folks here, one, a mayor on the ground who's dealing with the crisis of what it is for Black people in New Orleans. And of course, Dr. Jones, the stuff that you have pulled in terms of the sheer numbers, the ways in which we're impacted and disproportionately so, just some of the statistics, 70% of the people who died from COVID-19 in Chicago are Black. Right. So we're not talking about like some little fly-by-night numbers. We're talking about huge numbers. I was on a town hall earlier, and Brittany Packnett Cunningham was saying that people often talk about Wisconsin like it's just cheese and cows, but there's a whole Black city called Milwaukee, and folks in Milwaukee overwhelmingly and adversely impacted. To me, this is one of those things where we have to say for a long time, before we have Black Lives Matter as a mantra, right? People who were pleading with the government for our lives. People were pleading with the government for our health, for our economic stability and viability. Then we got a mantra, Black Lives Matter, after Trayvon was killed. Well, now we're saying that, but the only thing they will agree with us on is Black Workers Matter. Why? Because they're all essential. Right to the point. So whether it's someone who's coming to pick up your trash, it is someone that's a security guard at your building, it's someone who has to risk their life for you. That Black worker matters, but their survival does not. And that is the bridge that we have to cross. All of a sudden, people care, right? If you can come and do the work. Right, it's something that we've known since the beginning since the first slave ships that came to these shores. Your work matters, but you're not worthy of survival. There's always going to be another worker, and that's something that we can no longer afford. If we don't accomplish anything else tonight, Puff, I hope it is that there is a bridge that must be crossed tonight, that Black lives matter, Black workers matter, Black people matter, Black churches matter, but you better do it on live stream, right? Like there are a bunch of things that we have to cross to get this right. I started
This
with
is
that.
definitely the start. This is the start of the conversation. AOC, do you have something else to say?
Yeah, no, it's like Angela is saying it all right now because it really calls into question, why it's not just do Black Lives Matter, but why do they matter to you? Because for a lot of people, they cannot cross that bridge that she's talking about. And like, we shouldn't care about Black families and Black communities because they're the ones that deliver groceries and they're the ones that stock our shelves. And it's because of what the utility is to another person. We should care about each other because of the fundamental human value of life. And we have to see each other as brother and sister in a real way, in a real way. And all of that, it translates into some of the decisions that we're talking about, like what Charles brought up in terms of why we care about some things and what policies. When you look at the emergency policies, some of the things that we're pushing for, I mentioned earlier that Rikers is in my district. We have been pushing to decarcerate these jails for weeks because they are a ticking time bomb. We had the first case pop up in Rikers confirmed, but once you get that first confirmed case, you know that there may be dozens others because these tests are so hard to come by that they don't give tests to everyone exhibiting symptoms. And lo and behold, weeks later, now you have dozens of people that are caged right now and prison workers that are in there, and it is spreading like wildfire. And yet we're still having resistance to releasing people on elderly clemency, to ending pretrial detention. The first COVID death on Rikers was from a person who had a simple civic parole violation, not even a crime. Not that it even matters, because nobody, no matter what you do, should die in the indignified way of not having access to healthcare because you are trapped in a cage. And so on top of that, you get the fact that they are putting prisoners on Rikers and sending them to Hart Island to dig mass graves, being paid slave wages. This is all confirmed by The Intercept in the city. Being confirmed to dig mass graves on Hart Island to bury the bodies, to bury the very own bodies of our community that is dying unnecessarily because of a failure of leadership from our administration, rather the president's administration, and just political leadership in general. It's the lack of prioritization of Black lives. And the reason that that's important is because we must always center the most impacted communities, because that uplifts all communities.
I want to give the last word in this panel to Reverend Al Sharpton. I think you built it up to where he can take it home for us. And Angela also mentioned the importance of having Easter at home. We have our own role in saving ourselves and saving each other. Give us some words of inspiration as we move to the next panel, Reverend Sharpton.
I was raised in the movement with one slogan: no one will save us but us. And we are going to have to do what we need to do. Yes, we're going to spend Easter at home. We need to really get into our family and create a bond that we are going to be the part that brings what is needed in our neighborhood, to look out for the elderly that has no one to get the groceries now, to deal with the lack of health care, to prepare for mail-in voting, because we need to put people in power, like AOC is saying, that will not have our communities rendered this way. We need to not look for Trump or anybody else to do this for us. Movement starts from the bottom up, not from the top down. We are in a disaster, and we must solve the disaster ourselves, because nobody's going to care about coming to get us. We are the ones that have to come and get us. This is Good Friday in a few minutes. We are in the midst of a crucifixion, but there will be a resurrection if we rise up and do what has to be done. And I believe that we have the strength to do it. If we could survive chattel slavery, if we can survive Jim Crow, we can survive this pandemic if we're determined to do it.
Hey, listen, I want to thank all three of you. I'm going to keep Charles Blow, but I want to thank ALC. I want to thank Angela Rye. I want to thank the Reverend Al Sharpton for your leadership and for your vision. And I want to move to one of the great experts who's.
Thanks, Pop. Thanks, AOC.
Thank you.
Thank you.
Now listen, we got some folks who we say they got some education in the issue.
Yeah.
And Cameron Jones is somebody.
I saw Camera Jones, Miss the Queen Camera Jones. I saw her with you on CNN, and that's what really ignited a fire up underneath me that she needs to be heard. Like, our leaders need to be heard. And yes, I'd like everybody to introduce Camara Jones.
Yep.
Hi.
Welcome.
You can give her the right introduction, though, Van, because I don't have the introduction notes. I'm just winging it.
Hey, you just winging it. Well, listen, part of the thing is, I had to learn how to say the word epidemiologist to be able to keep up with Cameron Jones. You got the beautiful last name. I love your last name. It's a beautiful last name. But we have epidemiologists who understand the science of how this virus is moving and what we can do to protect ourselves and why it's so dangerous. And she loves us, cares about us, and knows us intimately. Help us understand what's going on and what we can do to protect ourselves.
Okay, so I want to say, first of all, that so much has been said, but on the racism piece, if you were to ask me in one sentence, what is going on here today, COVID-19 has exposed again, but exposed in a very stark fashion, US racism, right? Because the whole myth that if this virus, so nobody on this earth in December 19 was immune to this virus. If there were equal opportunity, if there were equal distribution of risks, then no matter how you sliced and diced the population, you wouldn't see anybody popping out with more of it, getting it more or dying from it more. So this is clear evidence that we have an unequal society. We keep being reminded of that with Katrina, with Flint, we keep being reminded of that. But the reason that doctors like me and epidemiologists who see that Black people have been dying more often and earlier, we've been trying to sound this alarm for a long time, but the general public cannot turn their eye away right now because the bodies are piling up so fast that they can't normalize it and they can't ignore it. But the risk to me is that, yes, now we can say racism, and maybe some other people might even believe that racism exists for a moment. What we need to do is keep racism and anti-racism on the agenda. So the things that I can add to this conversation that's been going on before is to give a definition of racism which will clarify for us how it is causing these excess Black deaths. Racism is a system that does two things. It structures opportunity and it assigns value. And it does both of those things based on so-called race, which is not biology, it is not behavior, it is not culture, it is the social interpretation of how one looks in a race-conscious society. And this system of structuring opportunity and assigning value has three impacts in general, right? When we do talk about racism in this country, then we point that, okay, yes, it is unfairly disadvantaging some individuals and communities. But we have to recognize that every unfair advantage has its reciprocal unfair advantage. So racism is also unfairly advantaging other individuals and communities. That's the whole issue of unearned white privilege that we hardly ever talk about because it makes some people, especially some white folks, uncomfortable. I say if you feel uncomfortable, you need to lean into that discomfort because the edge of our comfort for all of us is our growing edge. But the point that we often miss, all of us, is that racism is sapping the strength of the whole society through the waste of human resources.
Yeah.
This structuring of opportunity and assigning value.
I gotta jump in to get my mayor in 1 second. Go ahead, finish your thought, and then I gotta get my mayor.
I just want to say,
the mayor gonna go to bed in a minute.
I know.
Okay. So,
You know
I
what?
think this definition.
Mayor, don't go to bed. Please forgive us, Mayor. This is the first time I'm doing this, Mayor.
I'm gonna let the mayor go. I'm gonna let the mayor go.
Yeah,
I'm gonna let the mayor go, but I need to come back to how
he
that
will.
definition helps us understand.
Listen,
Yeah.
I probably am gonna bring you back in, but everything you just said is having a real devastating impact on a city called New Orleans. And the mayor of that city is sitting here because she needs to let the world know what's going on in her city and how we can help her. Please, let's hear from Madam Mayor.
No, good evening and hello to all of you all. It really is an honor to be here, and thank you, Diddy, for making this possible. I mean, you all have said it all, right? You know what's going on. The social determinants of health is wreaking a havoc across this. Absolutely a part of that. Americans make up 33% of the population, but in the city of New Orleans, we make up 60%, and we're 70% of the deaths, and we're over 200. And so the impacts of these disparities are not new. We've known about them. There's a lot of work even that's been happening on the ground, but we need the support on the ground. And we collectively, the community truly has to be the cavalry. Prior to COVID, right, we were losing people in our community from heart disease, all these chronic illnesses. I mean, we just buried Fifth Ward Weedy, 40 years old from, again, just the disparity gaps that truly do exist, as well as the inequities. But as it relates to the city of New Orleans, it is, we're seeing it, of course, on the ground. When the doctor mentioned, and I heard, preparation for the morgues. Well, I had to request 20 refrigerators from the federal government to build capacity locally for our coroner's office. So it's a real thing. I think that it has truly exposed the fragility in terms of our Black community, in terms of our working families that do not even make a living wage, those who don't have access to quality or affordable health care, those that do not have the social networks and safety nets in place. And so it really is time to double down on what we know is needed in our community, but also for us to be a part of that. We have to go to the doctor, we have to get our wellness checkups. It matters. But at the same time, we have to push back at that federal level, meaning to stand up for what we deserve. Census is right now. Mm-hmm. And I can't think of a better time to make sure that we're counted so that we can get the resources that we need. For the city of New Orleans, our last census was really 2000, because you all have mentioned Katrina. Our people were scattered everywhere in 2010, and 43% of the people responded. We left millions on the table, but when you think about the Black communities across the country, so we need to go and get our fair share. And even as it relates to the CARE Act, and Congresswoman, I'm so glad you're here, because of what has been passed, and thank you, but it's not enough. It does not even go deep enough about how we're losing the revenue to run our city. So I'm looking at a $150 million deficit.
Yeah. Well, look, the conspiracy might have jumped on us there to prevent us from hearing our brilliant Mayor Cantrell. But listen, she's not the only mayor that is out here, and she's going to be facing real serious challenges. Charles Blow, you are correct. And when you talk about the way that HIV was once seen as a kind of white disease, and then people cared, and then when it moved, people didn't care as much. What can we do ourselves, as Reverend Sharpton was saying, to sound our own alarm and make sure that we take this as seriously as we possibly can? And what lessons can be learned from the struggle against AIDS that can be applied right here and right now to us as we figure out how to take care of ourselves?
Well, I'm going to come in on what the mayor was saying, because she runs a majority Black city. There are 1,264, I think, majority Black cities in America now, and that number keeps growing. right? And so when you look at the data, the preliminary data, we don't have it all yet. Preliminary data suggests that places where Black people are not necessarily a majority are doing relatively well relative to places where they are the majority or plurality, right? So that is New Orleans, that is Milwaukee where they're the majority, that is Chicago where they're the plurality, that is Detroit where they're the majority, okay? That paints a particular picture. And if you look, people keep patting California in the back, and I'm realizing that there's not a single all-Black city in all of California. I'm like, I look at Washington State, there's not a single all-Black, majority Black city in Washington State. And I'm looking at this and thinking, we need to marshal resources to these majority Black cities, because whether or not we know exactly what is going on that's making those numbers so disproportionate or not, we can't wait to figure it out. That may have to be done in retrospect, because we need the help on the ground now. We need massive amounts of testing in those cities. We now, today or yesterday, I was saying at the press conference that Philadelphia, which has a Black plurality, Baltimore, which has a Black plurality, and Washington has a Black majority, and DC, which has a Black plurality, were also coming hotspots. There's a specific thing, specific to us and specific to our density. And I don't know what it is. I want the scientists to help me figure that out. But there's something happening around that. We need to just marshal resources and research into those spaces to try to figure out what is happening.
Mayor Cantrell, before we bring the epidemiologist back in, I know you have to leave us. Should there not be, given the fact that even President Trump has acknowledged this week that this is a specific catastrophe for Black people, should there not be a concerted effort to rush masks, tests, and ventilators into Black communities, into Black hospitals, into Black cities? Can you hear me, Mayor? Mayor Cantrell?
I can hear. Were you asking me? Well, no.
Yes, ma'am.
No. The resources are absolutely needed. No, the resources are needed on the ground, no doubt about it. Fortunately, for the city of New Orleans, I mean, I made the call very quickly, began advocating. We're testing more in the United States right now. We're second to Iceland. So the thing is, you do have to test up because you have to understand what your community spread is and be very honest about that so that you can bring people along and say, hey, you can't, the numbers don't lie. And so all around the country, as we've heard from mayors who are on the front line with their first responders and healthcare professionals saying, give me more testing, give me PPE. But right now for New Orleans, I'm interested in this antibody testing. I want it.
Okay. Now, Dr. Jones, you're an epidemiologist. I understand your critique of racism and structural racism, but you understand viruses. You understand public health. What can we be doing more of in the Black community? I understand that we got all these structural problems, stuff like that, but that's been going on for a long time. What would you, if you could wave a magic wand and make Black folk do something different, what should we be doing right now to protect ourselves?
Well, we need to make sure that we don't get sick, because once we get sick, we're going to get it worse, and then they're going to not value us, and they're not going to give us the ventilators if it's a choice between us and all. But the testing, so we need to, I'm going to say that it's not just us. I'm going to say that the government has a responsibility to protect the bus drivers, to protect the post office people and all like that. That part of the problem is not just that we have more high blood pressure and all. The problem is that we're more exposed, right? But we're not recognized to be part of the essential workforce. We're also trying to go to work because we don't have that background wealth. So we need more of that money and all to make it possible for more people to shelter in place. So I'm not going to say that I'm going to give the government a pass, because we have the Congresswoman right here. So what we need to do is be demanding more of that. We need to demand, as has been said before, that the resources go to the Black communities. If we think that there's a higher problem there, we have to provide resources according to need. But I want to also talk about testing, the testing strategy.
Wrap on testing, and then we'll bring in some more voices, but wrap on testing. We need that.
Yes, the testing that we're doing right now, when we just test people who have symptoms, is not the right kind of testing. That's going to confirm a diagnosis, but it's not going to be able to help us change the course of the pandemic. What we need to do is test. Yes. So what we need to do, as opposed to just having a medical care kind of testing to confirm a diagnosis, do they have it or not? We need to have a public health strategy for testing. So we need to test everybody who wants to test, who has symptoms, and we have to test a large proportion, a sample of people who do not have symptoms. That will let us know how much disease is there, which will let us know where we have to have the medical resources in 2 weeks. Because what we see today is a 2-week-old picture, right? It will also help us find those asymptomatic spreaders, don't know they have it, passing it around, who are infected. We'll ask them to isolate, and we'll also ask them, who did you talk to this past week? We will find their contacts, isolate them with the public health strategy of testing. We're not just documenting it, we can change the course of this pandemic.
Listen, it's so good to have people like you in the community that, as I say, have been educated on some of the stuff that we don't know about. And we appreciate you and your voice. We want to bring in, speaking of voices, some of the most powerful voices in the country. ASAP Ferg and Killer Mike are both here at the same time to talk about what's going on. And, one of the things that Diddy was very, very passionate about and concerned about is that sometimes we talk over folks' head and around folks' back, and people say, this is not for us, it's not about us. And so what I would love to do is to hear from you, Ferg, and we hear from you also, Killer Mike. What is it that the young people need to hear about this situation that can induce action and passion and help make them a part of saving lives?
Got to unmute.
Well, I can't hear you. Can't hear you. Got to unmute.
Unmute it.
Still don't hear you yet, brother. Yeah, brother.
Okay, we're going to figure that out. Let's go to Killer Mike.
Same problem. Hey, Mike, can you unmute?
Unmute. You muted, Mike.
Now, hold on.
Oh, there you go.
Okay.
There you go. Talk to us, Mike. Oh, wait, now he froze. Well, one of the reasons I wanted to get these brothers in here, this whole question around incarceration and the incarcerated populations. Part of what we have not talked about enough is that 2.4 million people are behind bars right now. Yeah, I can hear you. Let me set you up.
Okay.
I hear you, Mike. Let me just set you up. 2.4 million people are behind bars right now, locked up. The biggest prison population on planet Earth. A quarter of all the people on planet Earth are locked up in the U.S., disproportionately Black, brown, and poor. And they cannot socially isolate. They're not given access to soap, etc. And so we have been working hard to get some of them out to try to keep people from going back in for silly reasons and to get in all kind of masks and everything else. But that is a time bomb going off directly aimed at young Black America. Killer Mike, talk to me about that and talk to me about other issues that affect the youth.
Man, I'd just like to say, yeah, can you guys hear me?
Can you turn it up just a little bit, Mike?
Yeah. Okay, hold
on. Yeah, we can hear you, though.
Is this better, guys? Can you hear me now?
I can hear you.
Yeah, we're good enough.
Man, you got me?
Yes, sir. It's a little bit fake, but once you go, you're going to go anyway, so go and bring it. Yes, sir. Yes.
I'm sorry, guys. Technology will not let us be great. I'm hoping you guys can hear me. Well, this is what I have to say. We are perpetually in a systematic cycle of locking up Black people, and in particular Black boys. So what you have is conditions that create criminality, a lack of jobs, a lack of opportunity, an undereducated environment. You have our boys being picked up for things such as loitering, stop and frisk in New York would terrorize us forever, essentially new Jim Crow laws. My fear right now is that in our rush to contain a pandemic, that we are going to be targeting the very neighborhoods that we should be saving. People have an opportunity not to be in school and to be at home. Some people are still congregating. And instead of coming up with an effective public service campaign to encourage people to isolate or to be in solidarity just with the people in their house, we seem to be getting to the point of maybe arresting or pushing. Well, we're going to push those people right into a system that locks them in cages like animals and allows this virus to spread within the prison system to the guards and then out. So I would encourage us, government officials, people like my man down in Florida who's working, who I'm trying to remember his name, guys. There's a
Me,
brother working down in Florida on restoring the rights of felons. He's trying to get people
me.
out. We have nonviolent drug offenders that should be out. We have people are waiting that can't get out because of cash bonds. Those people need to get out so that they can self-isolate. So my fear is that the pandemic is going to further criminalize us, and I'm hoping that does not happen. I know a lot of times as entertainers and celebrities, we get on television and we give advice because we've been given that. But a lot of what I'm saying is coming directly from the brothers who are locked away. They're afraid, they're in a panic. And all my Christians out there, I just want to remind you, like Grandmama said, the last person that Jesus saved on that cross was a thief. It was someone who was condemned to die, someone who was a prisoner. So in this time of panic, let's not forget empathy, and let's not forget those that are locked away, because they are as important as the people that are being rushed to the hospitals.
Hey, listen, amen, amen. What do you want to add, brother?
Ferg, talk to us.
You hear me now?
Yes, I can.
Yes, sir.
All right, cool. Yeah. So I was gonna say, you brought up a great point, Killer, and I was just gonna say, like, I went to go see my grandfather the other day, and there was a lot of guys on the streets in the corner. I don't know if this is going into like the jail conversation you guys was having, but this is more so like how we could prevent the coronavirus from spreading amongst the neighborhood and just keeping everybody more safe. I just want to encourage the younger guys to let them know that like this is a real thing, because like myself, I wasn't watching the news. Everybody else was watching the news. Like being my generation, we may not be brought to the news, but like I had older people like my uncle and my mother put me up on like different things, and that led me to like telling my brothers and like younger guys, we gotta like really take this thing serious, because we taking this we might be strong enough to hold a virus, but we taking this virus back to our grandmothers and our moms and people that already have sicknesses within themselves and making it worse on them and making it worse in the community. So yes, we may be able to fight it off, but they may not be able to fight it off. And I just feel like I wanted to use my platform to say something, because I didn't see too many age group of my generation saying anything.
Well, listen, I think it's really powerful that you're doing it. And, I'm proud to be a part of the Reform Alliance. Part of the thing that Killer Mike was talking about is when you have people who are trapped in prison, we could have morgues. Those prisons and jails could become morgues from coast to coast if we don't do what he said. We've got to get the people out. A lot of people could come home right now with a little ankle bracelet or something, or just home confinement. And they could go right back. A lot of people, as you were saying, sitting there because they can't afford bail. So we have leadership though, from the streets to the suites. And one of the great leaders that we have that's come on the scene is a Congresswoman named Ayanna Pressley. And can you hear me, Congresswoman?
Yes, I was having some technical problems, but the devil is a lie, so I'm here.
Very, very good. I'm gonna come back to Killer Mike, but the squad, so-called famous squad, we heard from AOC earlier. Now we're hearing from you. Help us understand from the perspective of a community leader, somebody who's been on the front lines, somebody who has taken the fight all the way to the halls of Congress. How do you see this pandemic that we're in, and what should Black people be knowing and doing right now?
First and foremost, I just want to thank Diddy and just for using this platform in this way. Just grateful for a vehicle and a platform to be unapologetically Black. We have hashtags and T-shirts that say all of this, but being unapologetically Black means unapologetically fighting for your very preservation and existence. The reality is, because of the structural racism, systemic oppression, transportation deserts, food deserts, lack of access to fresh and healthy food, dominantly representing the vulnerable, essential workforce, every ism that you could possibly think of. We already knew what was going to happen before the White House even acknowledged that this was a pandemic. We already knew what was going to happen. History has taught us that. If you look at H1N1, Black folks disproportionately represented the mortality rates with the H1N1 virus. So I just want to say this, Black folks, I love us. Love yourself. You are resilient, but you are not invincible. I was at the supermarket yesterday and saw parents out with young children with nothing covering their faces. Black folks, we are resilient, but we are not invincible. And so the three things that I've been focused on is first, early on, I, along with other colleagues, pushed Health and Human Services to begin to collect racial and ethnic data in real time, to disaggregate it and to report it publicly. Now, every time we start talking about race, someone will accuse us of playing the race card. What they call a race card, scientists call a data sheet. We need to have this data. We are already collecting age and gender, so we need the race and ethnicity data. Now, yes, anecdotally, we know that we're being hit hardest by this. And we see Black men being hit the hardest by this, anecdotally. But what we need is the data to directly inform how those resources are coordinated, marshaled, and dedicated, right? So the data informs that. So what I need from folks, Diddy was looking for action items. We need for you to demand that your governor, until the feds give standard mandated guidance for all states to do this, to collect this data. It will let us know if there's equitable access to testing and treatment. Now, the other thing I want to say is this. Every time I bring up race in our healthcare system, some people think that we are casting aspersions against the heroes that are patient-facing on the front line. We are talking about structural racism that is so embedded that when Black folks show up at the hospital presenting with symptoms, they are being turned away. Why? Because they have been taught that we have higher thresholds for pain. It's why we have a Black maternal mortality crisis. So the reality is that because of the ecosystems, social hierarchy and stratification, every socio-economic racial fault line is being worsened in this moment. Black folks have been slowly dying for a long time based on a political carbon monoxide poisoning. And now it's just happening with a blunt tool and a club.
Damn. Well, look, that's powerful. One of the things that I think we're facing is a triple crisis. We have a public health crisis, which has now brought on economic crisis, which could bring on a democracy crisis if it winds up messing with the election. But the economic crisis.
We had the economic crisis first.
And
then on top of that is the health crisis. At the end of the day, when we start to talk about solutions, this is the start of a conversation. It's important, my grandmother always told me to just listen. So today, everybody, we're getting a chance to speak freely. But believe me, any change is going to come back to economics and us understanding our economic power. And us holding on to our economic power with the power that it has and that it possesses in order to make change.
Well, that's one of the reasons why I'm so glad that we have Aaron Betru on, somebody who really understands economics and finance. And we're going to keep Killer Mike on. He's somebody who's been preaching that neo-Garveyite economic gospel of uplift and Black economic empowerment. And I want to thank Brother Ferg for being here and speaking up for the young folks in the community. You are 100% correct, sir. Maybe a young person might be able to deal with the virus, but I tell you what, if you got an asthma inhaler in your pocket, I don't care if you're 25 years old, you're not as strong as you think you are in the face of this virus. So even our young people have to be careful, and also be careful for our older people. But thank you for being here.
Ferg, before you leave, what do you have to say to the hip hop community?
I have to say to the hip hop community, we must take this thing serious. We must we got to be separated. We got to take this time and just stay in the crib, and we can't be outside sharing blunts and drinking off of each other. You got to really relax and take this time out and just cool out, because actually us meeting up and grouping up is killing us. So we can't do that right now. And I want to shout out Dr. Sampson Davis. We have a talk coming up on Saturday on my live. Y'all can tune in. We're going to be talking about the coronavirus in the neighborhood. And we actually had this talk last week about Black people and how it's affecting our neighborhoods. So we just got to keep pushing this envelope and letting people know what the deal is, because it's hitting us the hardest, which like everything else does hit us the hardest. So we gotta keep striving.
Yeah. Thank you. I'm going to ask Killer Mike.
Ferg.
Thank you, Brother Ferg. Hey, Killer Mike, turn your camera sideways if you can, so we can see how it's supposed to be. And while you're doing that, Brother Bay True, you're somebody who has always been on the cutting edge of understanding the economic situation for our community. You're a global thinker. Help us understand how we should look at this. I mean, they're saying the unemployment might be 13%, 20%. If it's 13, 20% for everybody, it's going to be a disaster for us. How do you see it, and what should we do? Oh, I can't hear you, brother. You got to unmute, I guess.
Thank you. Can you hear me now?
Yes.
Yes, sir.
Okay. Thank you for spotlighting this issue, Diddy. This is something that we knew this was in the backdrop for a long, long time. There's been a whole body of research looking at social determinants of health, all the issues that are mixing between health issues, social issues, economic issues. They're coming together in probably one of the worst perfect storms I've ever seen. And we're looking at this and we're saying, what is it that actually got us here? What is it that we need to do going forward? What is it that got us here? Just to take a snippet of what's happened in the past 10 years, we've been looking at this economy where everybody's been looking at one of the biggest job growth periods this country's experienced and saying, hey, everybody's getting a job. Even the African-American community are growing in jobs. But what they're forgetting is it's not about full-time employment. Our community's been actually getting mostly part-time and seasonal work. What does that actually translate to? That translates to less income. That translates to more vulnerability and job security. But it actually then puts you in a weird situation that you're in some of those jobs where in a crisis like today, you're the one that is out there, essential construction worker, food delivery worker, and others, that the health issue is actually impacting you more than ever before. Forget about the fact that the African American community has had longstanding underlying health issues that made them at risk, but our social and economic issues actually compounded it and made it even worse when we're hitting at something today. We know for a fact that because of all of this, we've been heading towards median household income for wealth for African American households nearing zero by 2053. All of that creates the worst type of foundation when a shock like this hits. It hits us really, really hard. But I want to say there's a couple of things we need to be aware of. We can talk about what got us here. We can talk about long term, but right now we need to stop the crisis. We need to stop it from happening worse than it currently is. And that involves a couple of things. That means making sure that our community actually has the information to protect yourself and your loved ones. One of your first speakers was talking about, well, wait a second, it's not just about me, it's about my family. We know through social issues, we've had mass incarceration where a number of individuals are growing up with a lot of senior members, their grandparents that are actually raising them. So young folks that are thinking, oh, this doesn't impact me. When you come home, you're hearing the family that's been taking care of you. So I think the big part of this information flow of just making people realize we are very much at risk. And know and protect yourself, know and protect your family. That's issue number one. Issue number two is we need to sustain ourselves. When we talk about flattening the curve, when we talk about not spiking, that means it's going to protract the time period that we need to be able to hold on. And that includes everything from supplies to money. And what is it, AOC made a good point earlier of saying, what are we doing as a community to make sure the vulnerable folks actually have access to the supplies and those food to be able to withstand this thing for a period of time? That includes everything from masks to gloves and the like. So we need to make sure that is happening.
Yeah, there's so many things.
Sorry, go ahead.
I just want to say there's so many things like that in terms of the things we're going to need to purchase and buy. I think Killer Mike is now in a position where he might be able to talk about how we need to buy blackness. However, maybe he's not. So you get your third point in. God, the devil is alive,
people. Anything can happen.
Anything can happen.
Aaron, how can we get to this?
Man,
how can we get to our fair
you're
share?
You're sabotaging me, man. You're making me move on. I don't know what's going on. Can you hear me?
Yeah, I can hear you.
Thumbs up if you can hear me.
Yeah, we can hear you.
All right, we can
Thumbs up. You can hear me?
Yes, sir. Yes, sir.
I can't. Okay. All right. Let me do this. I want to give the people who are actually on the ground some credit. All right. So you got Desmond Meade down in Florida doing the work.
Yes.
You have people like Yvette Carnell, Antonio Moore, ADOS doing the work, right? You have our Surgeon General, Jerome Adams, doing the work. What it's going to take is for Black people to show the solidarity that we have and we've always had. And right now, what we need us to do is to simply be selfish with our own personal health first, because that's what's going to truly protect your sister or brother. Taking care of you first, making sure that you're inside, that you're quarantined. And what I have to say to the artists in this moment, a lot of times we hear artists aren't important. We hear entertainers and athletes have no voice, but no one is as important right now because we speak directly to the people. Muddy Waters didn't have to ask for an act of Congress to do champagne and reefer. So he was 60 years ahead of the legalization curve. Right now, as artists, what we can encourage people to do is to simply do what our grandparents told us to do when it was a storm. Be quiet and let the Lord do his work. I believe if we sit in our house, if we do stuff like plant a tomato seed right now, learn how to grow something, catch up by reading, truly connect with our children, call your loved ones, that just like Passover, which is going on now, some of this will pass over while the experts like Jerome Adams, the Surgeon General, and others figure this out. We don't quite know what's going on, but we know we're bearing the brutal, blunt end of this. And what artists can do right now is constantly remind people to stay in. I got to give shouts out to artists like Lil Duval, who does it on a daily basis. Artists like my brother T.I., who makes sure people know. And all the artists up and down the coast, both coasts, are doing that. So I'm going to continue to do that. I'd like to encourage us all. And while you inside, fill out your census papers. And that's for regular people. Forget artists and athletes. While you're inside, let the world know we are here so we can have proper representation in legislation. So when these things happen, we have someone advocating under those gold domes for us. Let's make sure if you can't get to a ballot, that you do your absentee ballot so you figure out making sure your vote is cast, because now we see this is more critical than ever, who we have in office. So I appreciate the time for talking. I appreciate the other artists that are doing the work and everyone that is on this phone, including but not limited to the workers that are out there on ground level in hospitals, from doctors to nurses to the people cleaning these rooms. Thank you, thank you, thank you. And ultimately, guys, do not forget the prisoner in these times, because Jesus would certainly not do that himself.
Thank you, Killer Mike. Beautiful, well said, Congresswoman. I think he teed you up in terms of the breadth of what's needed. I'm sorry.
Yeah, I appreciate that, brother, so much. And just to that point, I've seen a lot of Black folks online saying, God's got me. Yeah, God does, but God sends us messengers, and God helps those who help themselves. So listen to the Surgeon General. In Dr. Fauci, we trust. Listen to Dr. Fauci. Listen to the health professionals. Listen to what Killer Mike just said. Black folks, stay home. And if it's actually essential that you go out, then protect yourself. That's keeping you well and others. One of the things that I do have to say is, just in the midst of this pandemic, is that by the hour, my heart breaks and fills all at once, because people are practicing that sort of Zulu Ubuntu, behaving well towards others in ways that benefit the community. You are seeing a cooperative. Do what you can where you are with what you have. Community is being re-stitched back together in this moment. So do what you can where you are with what you have. And I agree we cannot forget those that are most vulnerable, those experiencing homelessness, and our brothers and sisters that are behind the wall. And I too have been calling from the very beginning, since they cannot socially distance and the prisons are overpopulated, prioritizing compassionate release, clemency, all of those things. And bear in mind, in our county jails, the average stay there is 3 to 5 months. So 95% of those folks that are in county jails are coming into the community. And so the fact that folks are not being tested, that flies against the grain of the public health, both for that incarcerated person and for when they come out. And so that's been what we've been pushing the Bureau of Prisons on. In the CARES Act, we were able to get $100 million for the Bureau of Prisons around PPE and containment and mitigation strategies, $850 million for states and cities. But at the end of the day, we've got 10% of this population is elderly, have underlying conditions. They pose a threat to no one. We have folks that are incarcerated simply because they couldn't pay bail. Folks that are putting in petitions for medical parole. Those folks need to be prioritized on home confinement. But I also want to say this, since we have a crisis within a crisis within a crisis, we cannot have folks leave one vulnerable place and go into another vulnerable place. So we have to also make sure that those resources that we fought for in the federal government are being shepherded in such a way that support people in reentry and in connecting them to healthcare.
Let me talk about. Let me bring Aaron back in. Part of. Go ahead, Aaron.
No, I think the point that the Congresswoman just made a point of is, let's make sure that a big chunk of being able to sustain this is actually going to be all about the financial resources. And what I mean by that, everybody's been hearing about the stimulus package, but very few people realize this is actually the third bite at the apple. There was one that was like $8 billion for the government to be able to react to the emergency. There was another $105 billion that went to making sure that the sick were being able to be tested. And this $2.3 trillion that was all supposed to be about us being able to withstand this in an economic way. But that means actually individuals being proactive about being able to grab some of these resources for themselves, for their community, for their families. Yes, the first tranche was supposed to be about economic impact awards, up to $1,200 for an individual that makes less than $100,000. But if you exceed the $90,000, I believe it's where it zeroes out to comes down to zero. That means you need to make sure that the federal government, the IRS, has the ability to get this capital to you. If you filed your tax returns and they were able to get you a return electronically, then they've got that information for you. But if they don't, you need to make sure that they do have your address and other things. That is critical. Make sure that you have that, because that is not just fund money. That's your money to buy the groceries that you need, to buy the supplies to be able to withstand this over a long period of time, especially for the community that is in hourly wages and is very much at risk to being furloughed. The first big wave of jobs, everybody was saying, no, we're going to retain individuals. We're just going to, slow things down a little bit. Even today, there was a whole bunch of news that came out. A bunch of companies really could not be able to just slow everything down and keep everybody on payroll, that they're gonna have to let people go. And frankly, that means the individual, the member of the community, needs to understand they need to find the resources to be able to sustain themselves. The second part of it is that Paycheck Protection Program. This is all about a distribution that's going through the banks to individuals that are working as part of small business.
I think you got frozen. That
I think I think
yeah, maybe
I want to interject in. One of the main reasons why, when you hear about the $2 trillion stimulus, you don't hear about our fair share. Number one is we don't know how to get it. We don't know what forms to fill out, and we don't know where to go to get the money. So I'm starting a program next week that's going to show and give direction. One of the things that I didn't just get us on here to talk, I wanted to listen, and then I wanted to start to ignite the great minds that are listening all over, that God is bringing us, as we're listening, as we're talking about these overwhelming issues. You're talking about the people that we built America.
That's right.
I'm tired of being last. I'm tired of my brothers and sisters dying. I'm tired of not fighting back. And so this is the start of a conversation, but the part two of this is how we fight back.
Oh,
And
can they hear me?
look out for our fair share hashtag. Look out for that. I'm gonna be launching that, and I'm gonna be informing you guys.
Diddy, I want to jump in on that point that you were just saying
on how to get your part of the stimulus to make sure that your family survive. You're back with us right now, Aaron. So if you want to pick up, I was just trying to fill in for you for a second.
No, thank you for that. And I think you're spot on. Being able to actually make sure that people have the information they need to get access to some of these resources is absolutely critical. A lot of people are saying, this is not for me. This is for some other part of the economy. These are for small businesses. These are the places where a lot of our community are employed. You do have the ability to, whether or not you are by yourself a sole proprietor and you are an employee of one, there are mechanisms for you to be able to access these resources and pay for salaries. That is what it's meant for. It is for paying for salaries and paying for other things that are critical for your ability to sustain it. That $350 billion, that is a critical thing, but we may be recognizing that we need to top that up another 250, maybe even 500 billion.
Hey, Van.
Yes,
Van?
yes, Congresswoman. You want to take your
sorry,
last shot?
I know for a moment, but I just wanted to pick up on Diddy's point and just thank you, because these SBA loans are first come, first serve. And we know our folks are already starting at a deficit and at a handicap, because so many folks, they already know how to work the system. Representative Ocasio-Cortez and I were talking about venture capitalists already manipulating and working the system. The other thing is that this is the first time that nonprofits and faith-based institutions have also been eligible for these grants and loans from the SBA. So that means we are going to have barbershops.
Yes, yes. Well, look, I want to thank the Congresswoman, and I want to thank Aaron for bringing us so much good information. And I'm very, very happy and proud to know that Big Sean is actually in the house. We got Sean Combs and Big Sean, so we're going to bring him in. Part of the thing that I'm so excited about is that Robert Smith himself has also built an app to go alongside of some of the stuff that Diddy is doing that's going to be in the marketplace to help people. And we're going to put that information out there before the night is over. But Big Sean, are you there? Can you hear us? Are you ready?
It's a little lag because I can.
Oh, you fix your audio. Okay, then we won't put you on blast. Killer Mike.
No.
Yeah, Van, this is good as we get my camera though. I
like your camera like that, Mike. Van had a problem.
Van had me dribbling this thing like a basketball.
You can unmute it so maybe I know when.
Good from the video, Daddy.
Puff, what up? How you doing, beloved?
Hey, so listen. There's three different elements that we're trying to manage at the same time. One is this question of how we deal with public health and the racism there. The second is how we deal with the economic issues, and how we use our political power, stick up for ourselves and to fight back. And we get ready to bring other voices back in. Killer Mike, what are you hearing that you want to amplify and underscore?
I would like there. Well, it's on a lot of different levels. First of all, the work needs to be. We need the voices that we have online now are important, and they're important because they speak and point to the voices that are doing the ground level work. So my man Desmond Meade down in Florida, who has the Florida Rights Restoration, PIM, ADOS, them. The SCLC is still out here pumping them. We need people on the ground informing us. So one thing we need to do is politically require more of the politicians. We like personalities, but we need policy. We want policy that directly interjects jobs, healthcare, all this into our community. So let's demand that. The other thing is we need to go back to centralizing power in our communities. That means we should be making sure that our kids are going to colleges for trades in medicine, law, and things of that nature. And we need to bring that right back to our community, and we need to service those people with our dollars. And the other thing is that African Americans, if we're truly going to be independent, we have to start producing something. I don't care if that's a plant in your yard or a clothespin to put on a diaper and owning a whole factory. But as a community, we're going to have to get more self-determined. There's going to be a friend of mine named Kenny Russian called me. He's in the real estate in Tampa. He said, Mike, there's going to be blood in the water and there are going to be deals everywhere. So, brother, don't go buy a new car. Save up and buy some apartments and put your people and them in an affordable rate they can afford, and put a nursery there so that the working mothers can come home and get their children directly, just like a woman does here in Atlanta. So we're going to have to, and I'm talking to athletes and entertainers, it is time to become the business class of our community. To our community, It is time we be led by the grassroots people, and not just the people who put on TV, but the people that are doing the work, like Paul's Kids, which is right next to Bankhead Seafood, which Tip and I own. There's a young lady that runs a charity that's been feeding kids through this whole pandemic called Paul's Kids. So I'm looking for leadership right on the corners of situations I'm in, and I'm looking for us, the people who have the means now, to enter into compassionate capitalism and go into businesses that are going to cycle the dollar in our community.
Let me back you up on that before we go to Big Sean. I said before that we had Robert Smith has already created an app to go alongside what Diddy is talking about. It's called the COVID-19 Small Business Loan Accelerator. You can get this app. It's called the COVID-19 Small Business Loan Accelerator. And literally, you can hit a button and it's going to populate forms for you and help you get ahead of the game. So between Diddy and Robert Smith, we got people who know how business works trying to empower our community. So that's beautiful. Wow. Also, you said, Killer Mike, the importance of artists. I don't think there's a more conscious artist and from a city that's more beloved or more under siege than Big Sean coming out of Detroit. Some of the numbers out of Detroit have been horrific with regard to this virus. I know this is a brother that walks the streets, that puts his arms around people, who's been in the community. This is not somebody who's just a star. He's a hero in the community. Talk to us about what's happening in Detroit right now. What's your heart feeling like, and what we can do to help?
I mean, honestly, what's going on in Detroit is, just to put it in perspective, my mom's best friend died like a couple of days ago. A couple of my best friends that I grew up with, went to high school with, have it. More than half of my team from Detroit whose parents have it. So it's something that has been spreading at an alarming rate. Obviously, we know that yesterday, 700 workers at Henry Ford Hospital, tested positive for it by taking care of the patients there. And let me just put in perspective, at the beginning of March, I mean, like the last couple of weeks of March, I was in Detroit myself for just like, my family and doing stuff and, working on my album. And there was 2 cases there. So that just, you put it into perspective now, Detroit is one of the hot spots in the whole country. And on top of that, it's a lot of death tolls. You know what I'm saying? So it's really something that, another thing is that one of my friends who I know has it, he was down for a few weeks, and then I saw him outside, and I'm like, yo, bro, you don't need to be outside. You still spreading it. Like, you can't go see people right now. You really have to make sure that you're taking the right precautions. So I want people to know that even if they haven't, think they're getting better, it's people who've had it for 4 weeks and think that they got it. Like, no, you still are, a carrier of that virus, and you can still easily spread it. And I think that's one of the misconceptions that's going around in my city, is that like, okay, well, I had it, I stayed in, and now it's done. But no, it's not done.
Yeah. It's an unbelievable situation. Shaka Senghor, who obviously is, one of your big fans and a native son of Detroit, has done such a brilliant job of trying to get masks into prisons and working with the Reform Alliance, working with Jay-Z, Meek Mill, and others. And so that's that we're all passionate about and concerned about. But
Shaka, God bless Shaka.
Yeah, Shaka Senghor, God bless him. But when you as an artist and somebody who has a platform, what would you say to other artists to sound the alarm? Because to your point, even people who should know because they have the virus are not necessarily doing the right thing. What can other artists do to spread the word?
I mean, besides, I think other artists can just, let it be known, obviously lead by example by staying in, but also encourage people to, that this is a time of exploration of inner space. You know what I'm saying? This is a time to where, you really can discover your passion and not be led by the lights of society, the ego, this is a time for you to really go within and discover your passion. So I feel like, not just staying in, because, the thing is like when you stay in, people can look at it as like, oh, that's boring or whatever. But when you stay in, this is giving us a time that we've never been able to experience. Obviously, it's a time of tragedy, but throughout time, we've always made lemonade out of lemons. You know what I'm saying? This is a time of self-discovery, a time to really heal, and a time to look within. You know what I'm saying? So to other artists, I just feel like, to the platform that we have, like, I don't know how many followers I got around, on different platforms, but I definitely put out like a list of books that I was reading. I put out, I've been painting, I've been doing things. Obviously, I've been also working on music because the music is in my house, but I just been staying like self-contained and preaching that and letting them know
Using
that
it
there are
well.
other factors and other things that we can do right now.
Yeah, and using the time, actually having the time serve us rather than just sitting up here and letting the days go by. Another
Yeah,
somebody who
man,
loves.
I want to say on that is very important that we use this time wisely. This is all God's divine order, and He's not giving us this time to waste it. And
That's
and
right.
and we are put in this position, our backs are up against the wall to figure it out. We're starting the conversation and having the discussions, but we have to be a part of the solution. And sometimes you have
Yeah.
to, in order to get that greatness, you have to be isolated. And that's what's happening to us now. And I would say to the hip hop community and to the younger generation is to be honest, is your world. And and
Yeah.
and and you have to protect it. And you
And
have to
what?
take it seriously. I've never seen nothing like this, and I've seen a lot of things. And I've actually, to be honest, I've gone through it. When Kim passed away last year from pneumonia, nobody knew what it was, and it was out of nowhere. And I was put on a real serious timeout, and I used that time to really, really reflect and to really, really look at who's important in my life and what do I want to do. Because we still have a responsibility. We still have a destiny. We weren't just sent here to be ex-slaves. We weren't sent here to be the last on the totem pole. We were sent here to one day to stand up and to fight for ourselves and to fight for ourselves in the right way through our intelligence, through our mind, through our compassion, and through our hearts. So please, I just want to add on to that. To me, the most powerful culture in the world, the hip hop culture. Let's use this time wisely and think about how we can help others and think about how we can save ourselves as a whole community, all the races, everybody together. But we got to put that mask on first. Even on the
And
airlines,
my
they tell you put that mask on first. And we have not been doing that as a people. And that's what I want us to start doing. Let's put that mask on first, isolate ourselves, and let's use this time wisely and connect with God in a way like we've never connected before to find the cure for this and also the cure and to break the curse. Because
That's
this has
right.
been an ancestral curse. And it's time for us
yes,
to break the curse, and that has to come from within. So if you could dig me and you on that
yes,
frequency, you know what I'm talking about.
yes,
Let me
man.
bring.
I feel everything you're
Yes.
saying, and
Let me
I
bring
wanna
in one
add
more
on to
voice.
that, Puff.
Let-
I just wanted to say, Puff, like, to add on to that, like, we'll never get another time like this in history ever again. You know what I'm saying?
We hope.
So it frustrates me when I see people talking about, I'm bored. Yo, you know how many things you could be doing like in the house. Now it's different if you can't provide for your family. It's people out here that's going through the most terrible times of their life right now. You know what I'm saying? The most devastating times. But for the people who just like, oh, I'm bored, or you've been on the internet more than ever, it's just like, yo, there are so many things that you can do it's just all about balance. You know what I'm saying? Of course, this is a time for us to come
Talk to a
together.
bunch of smart
Like, I
people.
think this is
I gotta
amazing.
bring in. I got one more voice from Detroit. I gotta bring in, brother. I agree with the balance, and I want to also balance the time out and make sure that Royce, the 5'9", gets a chance to
Oh, the
speak on this.
God.
All you know, yeah, you
What's
know,
up?
you
What's up,
talked about
everybody?
What's up, bro?
a true
What up,
Detroit
Can
though?
y'all hear
legend.
me?
Yes, we can hear
We
you.
can hear you.
How's everybody doing?
God,
And we safe,
Good.
supplied, and
got to get we all together trying to start this, conversation and really just hear from, our brothers and sisters that's in the communities. And we know Detroit's been hit hard, and we know you're one of the kings of Detroit. So I definitely wanted to have you on to hear your perspective.
Well, thank you for doing this. First of all,
Yes, thank you.
I think this is a perfect time for us to really look at the truth. Like this is a catastrophe that we're dealing with, and Black people, for all intents and purposes, are like sitting ducks. Like we need to start thinking as a village. We need to start thinking as a collective. Because my dad tested positive for it, and I believe he works at the post office. So a lot of these blue collar workers, they don't feel like that they have the Black fellowship to fall back on. So they're willing to go take the risk and go work those jobs and put themselves in the line of fire. I just think that we need to focus on ourselves year round, not just when it's like, what I'm saying, like a disaster. We need to focus on ourselves year round, focus on our community year
Yeah.
round, like a lot of things that Killer Mike was saying. Like if it's building schools, I mean, we got everything we need within our community. I think we just need to focus on us, and we need to stop letting people make us feel uncomfortable with loving ourselves. Like with thinking as a collective. Every time we say anything that involves us coming together, they go out of their way to let you know how uncomfortable they are with it. Well, I'm uncomfortable with them being uncomfortable with it because I'm just tired of things affecting us in a way that they don't affect anybody else. And I'm tired of looking to the hierarchy of the government to help us out. I think we need to start putting systems in place that are going to offset some of these systems that are put in place to destroy us.
Royce, why you think it's spreading so fast in Detroit, bro? Like, why? Like, I don't really get it. That's something
Well,
that I don't even. I don't know if we had the answers to.
I think it's possibly a lack of information, but it's also how many people are marginalized. Like they put in certain areas, and like just the foods that are ready available to them. Like the high volumes of sugar and stuff that's in the foods, and all of these things that kind of break down the immune system. And this particular virus just seems like a virus that's specifically attacking that. You know what I mean? So,
Period.
you're talking about something that can lay dormant in your system for 2 weeks, the first 2 weeks, without you having any symptoms, but you can also spread it. And then when it's time to attack, it's attacking the weakest of us after we spread it all around, So it's really really tricky.
Yeah, it is.
Yeah, part of the thing I think, in addition to self-isolating, using the time well, we got to focus on our health. There've been sisters and brothers in the community. We call them hoteps and stuff. Make fun of them. They try to get us to drink green drinks and stuff and juices. No, we don't want that. We want the Diet Coke. And we've been laughing at them and making fun of them, and they're the ones walking around healthy, and the rest of us are getting taken out. We have to strengthen our own immune system. When it's a virus, your body has to fight it off. There's no drug that can do anything about it. And so your body has to be strong. We've got to make health as popular as wealth in order for us to be able to survive and to push forward. There are other voices that want to come in, and I want to make sure we hear from everybody. But I
want to say that that's one of the most important things that we're going to come back to, even if it's a part 2 to this conversation, is the things that we can do, the importance of the health and wellness, the understanding the responsibility that we have from our bodies that God made to make sure that now that we know the fact and we know that we could just be killed at any time because all of the sugar and all of these processed foods is pumped in our community. All of this is by design, yo. Y'all on Revolt. You're not on CNN. It's a Black-owned station. All this stuff was by design. It's not conspiracy theory. None of that, But we have to take responsibility. We have to go back to our ancestral roots and understand that we have cures for this. And we're not one of the things we're not talking about is we're not talking about how we build up our immune system during this time. How do we fight against it? We can't just lay and sit back. We have to change the way we're eating. We have to change the way we're living. There's no other choice. It's that or die. And so we will
Hey,
continue
please let me be.
that
Please,
conversation. But I wanted to make that statement though.
Yeah,
hey,
last
please
word,
let me be a
Sean.
part of that conversation. Please let me be a part of that conversation because I take,
Yes, sir.
you know, supplements, vitamins, alkalizer drinks, alkaline machine
They know
conjugated
I'm in
water.
here, man.
I have a very alkaline diet, and you know what I'm saying. I love to share like all the things that I do. You know, I haven't been sick
It's so
in
important.
long time, so
Yeah.
let
Well,
me know
We're
when
listen.
that
gonna have a
So
part
conversation
two.
is.
We're gonna have a part two to that, man. Keep it rolling because we have some people that's
Yeah,
been waiting
that's good.
for a minute. And I want to thank
We got.
you, Joe, YB, and Corday. Thank you, Shara, and everybody else that's on.
Yeah.
Thank y'all for waiting and being
Hey, God
patient.
bless everybody on here.
Yeah, thank you.
Peace.
God bless Detroit.
No, thank
God
you.
bless
Love
Detroit.
and respect, y'all. Love and respect.
Love, Roy.
Hey,
Yeah.
all right, so we're gonna bring on people that don't even need an introduction, but we got Fat Joe here, we got Yara Shahidi here, we got Corday here, Dr. Justice here. So we're gonna have a whole different round of conversation now, especially bringing forward some of the voices of the sisters, some of the people who are younger. I want to start out with you, Yara. You know, the young generation was kind of lied to on this. It was told that only old people need to worry about it and the young people are safe. Now we're seeing people dying at 50 and 40 and 30 and 20 in the Black community. What do we need to do to make sure that this generation knows that this is real and it's coming for young people in the Black community because of our asthma and other issues? Our young people have that we're very vulnerable. Wait.
I think you, Yara. I think you're on mute. Let's try to fix this down.
Can say something else, sis? Only the tiny little bit. I'm gonna go to Fat Joe and then come back to you. I want to make sure
Yara,
your
keep
voice.
trying. Yara, keep trying, and when we hear you, we'll signal you. But Fat
Exactly.
Joe, my brother, Joe, you
Hey,
there?
I'm here.
Joe,
so
I wanted to get you on because you one of the realists in the discussion. You one of the realists, and we need to give it to our people real. And I put this together for African Americans, but you know my extended family is also Latinos, and we're both getting affected by this. And I wanted to just invite you into the conversation as a part of the hip hop community, one of our leaders, and also because you keep it real. I want this. I don't want what they say going on CNN. This is the real news. This is news that's affecting us. Talk to me, Joe.
The real news is our youth is acting very ignorant and they're not caring about their parents, their grandparents, their neighbors, and we have been screaming. I've been on my IG live every day, 8 o'clock to 9 o'clock. I don't know how else to scream. I don't know who could talk to the youth more because, when I'm calling my people in the Bronx and my brother got to go to the supermarket the one time in 3 weeks, they still hanging out in front of the building. They still passing the blunt. They still hang, and it seems it's so crazy. And I don't want to sound like an old school hater, but it's like this young generation feel like they can't die from this, and they don't care who dies from this. And it's real sad that I'm talking amongst us. I'm talking about us, our people. I'm telling you the real. The real is we gotta find a way to get in these young kids' face. It can't be sugar coated, it can't be nothing. Whether it's we gotta talk to our young influencers, if it's the young thuggers, if it's the young whoever the youth is really listening to, they gotta step up and they gotta tell these people, you are killing us. So what happens is 2 weeks ago with spring break, they was all out here partying spring break. They went back home and they gave it to their parents and all that. Now 2 weeks later, we got the deadliest killings ever. On people dying. And then the thing is, what's a coincidence? What's the joke? The beginning it was black people couldn't catch it. Now black people and Latinos are dying the most. And the
Yeah, that's
joke
right.
is always on us.
And
Yep.
the biggest thing is people are dying like a light switch. I mean, like a light switch. It's like everything you ever lived for in your life, everything you ever accomplished, everything you ever went to is taken away from you in 2 days from this coronavirus. It's the strangest thing. You can't even have a funeral. We can't even pay tribute to you, right? So I'm doing
But let
jumping
me bring in.
jacks.
Yeah. Well, listen. I want to listen. I think you put it down, and we have some young people who might be able to have some insight and also have some influence. Yara, are you ready for us?
Yes,
Are
can
we
you
ready
hear
for
me
you?
now?
Yes, we can hear you. Honored to have you, sister.
Amazing. No, honored to be here. Yeah, and when I think of just my generation as a whole, I feel like information dissemination has been key because we have been hearing so many different things on this, primarily starting with the idea that it just doesn't affect our generation and really not expressing the expansiveness of who could be considered immunocompromised. And even turning back to your point, to asthma, to all of these things that you may not make the connection between as having a compromised immune system. And the one piece of advice that had been given to me and that we had heard that I thought was so essential and goes to the essence of what's been said is the idea that don't walk around as though you're trying to prevent yourself from getting corona. Walk around as though you already have it and you're protecting the other people around you. And so that's the extensive level to which you have to care for the people around you, regardless of whether you think you can be affected. And as you've said, it's been proven from all the cases that we're seeing, unfortunately, that people that we didn't think were going to be as direly affected are really going through it. And so that has been the piece of advice. And I'm grateful to be in a position to be socially distancing, but it's also, if you have the privilege to socially distance, we're doing it on the behalf of the amount of people that don't even have the opportunity to do so.
Yeah. Corday, I want to get you in here as well. You have a whole bunch of people who listen to you, who love you, and who are following you, and we all know your future is so bright. How can we get the next generation to be where you are on this issue?
First of all, can everybody hear me?
Yes, sir.
Yes.
So,
What's up, nephew?
first and foremost, what's up, Unc? How's it going? I appreciate y'all having me on this platform. Honored to be on here with y'all. But first and foremost, we just gotta take it more seriously. Fat Joe made some points, and I just feel like we just gotta take it more seriously. And I feel as though it's literally a global pandemic. It literally cannot get more serious than this. So but obviously at first through social media, like via Twitter, Instagram, coronavirus first originated as one big joke. It was, everybody literally took it as a joke. And it was at first, us as black people, we can't get it, and us as young black people, we really can't get it. So many, folks around my age and even younger, weren't taking it as seriously as it should have been, from the get-go, versus, it taking like actual people that we know and we love getting it. My best friend, his dad has it, and he's in the ER. It takes like those personal cases that we know in order for us to take it more seriously. So I just feel like we just gotta obviously self-quarantine, stay away from each other, stop social gathering. Like some homies hit me up in a group chat like last week, like, what's the move? Like, the move is the crib, bro. You know what I'm saying? And I just feel like that's a huge thing with it, just socially distancing.
Yeah. Well, that makes me want to bring in Dr. Jess. As I said before, we got some folk in our community that are educated. Dr. Jess came out of Cornell Medical School. She's a Black psychiatrist, and she's got a real unique set of insights. Some people are having a hard time with the social distancing. And I just wanted to get a kind of insight into you. On the one hand, some people are not doing it and they're hurting other people. Some people are doing it, but they're finding it hard psychologically, spiritually, emotionally. We're such a social people. How do you see it, Dr. Jess, the psychological dimension of what has to happen?
Yes, thank you so much for having this. I think it's important, Diddy. You have always been in front of this, so thank you. I think it's important for people to really understand that right now the focus is to end this pandemic, right? So we all are practicing or should be practicing extreme social distancing. And so one of the things that I encourage people to do when they're in their homes, is to really use that opportunity to be still. Okay, I know it can sound really cliche, but being still is an opportunity for you to address anything that's been holding you back from your past. Someone mentioned earlier an opportunity to really read up on different books. Actually, I would recommend 3 different books right now if people want to understand the social implications of how our health is, affected differently as Black people. And that would include Medical Apartheid. You can learn about the long-standing history of experimentation on Black bodies. Also, the new Jim Crow. If people are trying to understand what the hell is going on with our mass incarceration and what does that really indicate, it's an excellent book to read. Also, The Color of the Law, to learn about what segregation actually did for our housing. So this is an opportunity for people to really read up and become more learned. All right, but it's also an opportunity for you to use technology in a way to stay connected, right? There's Zoom parties. I was on one earlier, celebrating my aunt's birthday. There, is FaceTime. There's a way to stay connected in a meaningful way so that you aren't suffering from the impact of social isolation, which again can lead to depression, anxiety. It can have a lot of implications there that are negative.
Well, listen, part of the thing is we do have the opportunity to be very innovative, to take this time and use it. How many people say, oh, I just wish I could just slow my life down for a second and really focus and pray and get my health together and get connected with my family. Well, look what you prayed for. It didn't come the way that we wanted it, but it came. And so, for you, I love what you're saying by giving us the education, the information of how we can use this time really, really well. I think that's invaluable. I want to give everybody just one last comment before we go. Fat Joe, you have been so passionate on this. And you're somebody who generations of hip hop folks have just loved and admired. Why did you jump on this so early? A lot of people were sleeping on it. You were never sleeping on it. What made you understand from the beginning the danger of this?
Man, I just knew that it was a serious thing, and I'm always watching. So I was watching what, I don't want to point the finger at nobody, but I was watching what it was doing in China, and I just knew it was gonna come over here. And I was just wondering when was they gonna, and then they were saying it was a hoax. They were saying that it was this and that. And I just took it really, really serious. And because I'm pre-diabetic, and they said the underlying illness, I turned around and said, yo, hold up. They ain't catching me out there. I ain't gonna get caught slipping. So I've been in the crib, I've been in the house. My mother and father's quarantined. They can't leave the house. Nobody. So we've been following all the rules and trying to do the right thing. And then mostly just use our voices like we're doing now, but just use our voices to just let our people know. Because, we talk to a different, we cut all that gray area, and we talk straight to the most vulnerable people. And so I said, yo, we got to start something. We got to start talking to everybody, because maybe they'll believe it if Fat Joe tells them, stay in the house, chill, you're going to get your parents, And this, let me tell you something. I asked Dr. Oz today, has he ever seen a more infectious virus in his life? He said no. And anybody that wasn't listening to me, every one of my friends that I told stay home, listen, this, that, every single one of them caught the coronavirus. Every single one of them who was like, yo, Joe, it's $3 margaritas. Yo, Joe, we out here. Yo, we and they all caught it. They all caught it. And now people's parents are dying. A lot of people dying in New York. We from New York. So like that's the war zone. So every day I wake up to 4 people I know dying. I don't even want to look at the phone. Like when I pick it up in the morning, it's like, yo, do you know the security guard Saeed? Do you know this guy Danny Vargas? Do you know Marisol's mother? Do you know, it's just killing people. Killing. Like,
Well,
and yeah.
as bad as you may feel about it, and we all feel terrible about it, I know for a fact you saved a bunch of lives too. Because some people didn't listen, but I'm telling you, you were one of the first ones in the community ringing the alarm, and so you saved a lot of lives as well. Let's try to save a few more lives tonight. There might be somebody who's they're just coming in. They say, "Oh, I heard it was kind of a hoax, but Diddy's calling us, so let me check in." Corday, what if there's some young person who's coming in right here at the end? What do they need to hear from your heart? What do you need to tell them to make sure that they save a life tonight and tomorrow until this thing is over?
Think of your neighbor. Think of your community. We all gotta stick together, especially in times like this. If you got some older folks like in your neighborhood, in your apartment building, go out, grab them groceries for them. Even if you're not in a position, to physically or monetarily help somebody, it can be something as small as like, hey, bro, the Piggly Wiggly restocks on toilet paper tomorrow at 8 a.m. Just spreading the right information and, taking it seriously and using this extra downtime to better yourself. I've been in the house, just thinking, plotting. Not everybody has the luxury to, use this downtime, to think or meditate. A lot of people are going through the worst time of their lives, but if you do have that spare time to do that, just try to better yourself in whatever way you can. Come up with game plans, make a vision board, write down your goals, or, just anything. But just take this as seriously as it should be. It is literally a global pandemic. It's like the worst virus spread since the 1918 flu. I haven't seen nothing like this in my life. Y'all never seen nothing like this in y'all life. So we should take it for
Nobody
what it
alive
is
has.
and help and uplift one another.
Dr. Justice, does that sound like good advice to you? And what would you add to it before we give Yara the last word? What would you add to that?
Yeah, that's excellent advice. I think one thing that Black people need to understand is that we are more likely to carry illnesses, right, that stem from all of these social factors that many people have talked about. So it's not just a disease that's affecting old people. If you have asthma, if you have diabetes, the sugar, if you have high blood pressure, hypertension, right, if you smoke, these are risk factors that can make you more likely to end up with severe illness. So that's another reason why practicing social distance is going to be important. I would even encourage people to really understand, if you're going to wear the mask and the gloves, you got to make sure you're washing your hands. It's not just about having the mask on, touching your cell phone and all these other things, right? You got to make sure you're practicing adequate hand washing. And at the end of the day, when it comes down to our psychological and psychiatric health, it's going to be very important to just maintain a good overall health. Make sure you're prioritizing getting as much sleep as you can, right? Make sure that you're getting the vitamins that you need to try to boost your immune system. Stress kills our immune system, right? Stress is what makes our immune system not function well. So you want to try your best to move around in the house, be as active as you can. And to, your point, if you're not able to, I think there's so many frontline workers who are not just healthcare workers, right? It's our postmen, the UPS people, it's the people working at, our grocery stores. It's going to be important that we do this so that they can continue to support us, but that they can also be healthy for their families.
Well, listen, that was good advice. I hope somebody was writing that down. That should be posted. That was literally like a roadmap to how to get through this healthy and with our minds in a good place. Yara, you are healthy. You're brilliant. You're well connected. What advice do you have? There might be somebody sitting there saying, "Hey, it's easy for you guys, but I'm scared. I don't know what to do." What would you say to one of your peers who's just now really understanding tonight that this thing is real?
Absolutely. I mean, I think the advice that's just been given has been pretty perfect and essential to listen to. But when I'm thinking of being in conversation with my peers, I'm grateful to be in a peer group that's been very responsible. But the one thing that we've done for each other is exemplify what it really means to be a support network, which again goes back to the fact that this time exemplifies no action is too small. That call to your friend to check in to see how they're doing, that call to say, okay, I'm making an essential grocery run. Is there anything that you need? Those do save lives. And a lot of it has been, how can we continue to remain in support and in communication and of service to one another, because all of our needs are inevitably different. And I think as much as this has been referred to as the great equalizer, we have to acknowledge the difference in everyone's position and try our best to respect it. And if we have the opportunity to and the resources to, find ways to bridge the gaps of inequity that I think all of the systemic inequity has been very prevalent right now.
You know, just one more thing. You said you've got a responsible network of people that really know how to help each other. And that's really something that, I mean, all of us have these cell phones or people in there that we had beef with 5 years ago, people we broke up with 7 years ago. Isn't this a good time to reach out to folks and start healing some of this stuff and just say, hey, I'm just worried about you. I'm just, how are you doing? I mean, am I right? It should, if a global pandemic is not an opportunity for you to reach out to somebody who you love or who you used to love and heal that, when is? Am I right, Yara?
Absolutely. I mean, I even think of it spreading as a sign of us ignoring the fact that we are inherently interconnected. The idea that when it happened across the globe, it was like, well, that was a them problem, and now it's an us problem. And so I think it is essential that even on an interpersonal level, we begin to reinstate the interconnected nature of how we operate in our community.
Yeah.
Well, Van, I want to jump in on that and say that there's a cure, and that cure is love. That cure is love. If we all really look out for each other, that's a different type of virus. That's called a love virus. If we can't love nobody else if we don't love ourselves and we don't love our tribe first. This isn't about just about talk. I'm committed to keep on putting out the information because the information is the currency, but it has to start from within. Every person that's listening to this has to spread this gospel, because we have to look out for each other and to be solution based. As we talk about these deaths, it's going to get worse. It's going to get worse, y'all. And we're going to have to, batten down the hatches, and we're going to have to really tie into our faith. And the way that we could stop it from getting worse is by isolating ourselves, by respecting what it is, by also just looking and doing research on solutions. Shout out to Dr. Sabi. You know what I'm saying? We have different people out there that have that come from our ancestral magic. If we start to love ourselves, we'll start to see and feel those visions. Even my Latino brothers and sisters, we're not talking about no voodoo or no magic. We're talking about love. And we're talking about things that God gave us from the earth. And we have to be smarter. We have to be a smarter people. We have to break the cycle. And that's all in love. That's number one. Number two is economics. The economic factor, we have to stop ignoring it. We have to stop letting ourselves get pushed out of the way, not getting our fair share. We're coming for our fair share. America, we want our fair share and more and everything we deserve. We built this country. The way we're being treated is beyond a race issue. This is a human rights issue. If this was going on anywhere else in the world, dictators would be hung. Okay, so this is something that's real. We have to understand the power of our economics. We have a power in that, and we have to reset that, and we have to put out a new plan. These are solutions. Our prison population, we cannot turn a blind eye to that. There's just no way they're going to survive, and it's going to be one of the greatest disasters since we've seen. Going back to the times of Hitler, it's that bad. It's that evil. And we need to wake up and we need to love ourselves. I'm not giving y'all no shock value. I'm giving it to you real. We are making up more than half of the deaths. And the way we have to do that, we have to take accountability, and we have to start to change from within and within our communities. And hopefully tonight, tonight has been the start of that. And yes, this is conversation, but I promise you, I will follow it up with action with whoever wants to get down with the smoke and make some changes and make a difference. Because I'm tired of this, man. Enough is enough. And we could do all the talking, but let's get to the action. I just want to thank everybody for coming on. This is the first time I did this. And Van, I want to make sure I don't have no beef with CNN or Fox or anybody. No, it's important. Here at Revolt, when we doing this, we can speak, we can say whatever we want to say. They're not going to, unless they going to turn us off, and then we're going to figure out it. They're not going to turn me off, though, because I paid to stay on. All right? And I'm a majority owner of this, and I'm proud to have given us this platform. And Van, I'm proud of you, Van, because if we didn't have no Van, we wouldn't even have no voice, period. You are our only voice, our trusted voice. You're not our only voice, but you're our main voice. You know what I'm saying? You have shows. You're in the trenches along with everybody that was out. So I want to give a shout out to Al Sharpton, of course, the Godfather,
Angela,
who started the whole thing. Take it back to Malcolm X, Stokely Carmichael, James Baldwin. I want to say to my sister, I gotta just say to my sister Angela Rye, because it's been like, just 2 years of me seeing her courage that has amped a lot of us up and made us more vocal. Charles Blow, he always has something great to say. Thank you for coming on tonight. Big Sean, Fat Joe, you always keep it real, my brother. Whatever it is that's going on with us as a people, you care. You always keep it real. ASAP Ferg. I got to give a shout out to New York. New York, the strongest city in the world is getting hit the hardest. Just please pray for my city, pray for my state, pray for Jersey. Shout out to everybody. We're gonna be doing something on Sunday to be sending some resources to New York. Royce the 5'9", Killer Mike, LaToya Cantrell, Aaron Butro, Ariana Presley, Kamara Jones, Camilla Harris, AOC, Dr. Jess, Yara, YBN Corday, and everybody at Revolt. I love you guys, and I'm gonna let Van wrap it up. But thanks everybody, and we will follow up on this. God bless.
Hey, I have nothing to add.
Yes, sir.
I have nothing to add. That we're just getting started. And listen, I've got a chance to spend time with Diddy. The passion and the love that this brother has for our survival, for our success, for our thriving, and our growth is unmatched. And we're just getting started.
All right.
Yeah.
Love y'all. Peace. Blessings. I see y'all on the front line. Let's get it.
Yes, sir.
Hey everybody, it's good to be with you this evening. Sean, I want to thank you because you always have a way of convening and bringing folks together and using the